Hi, it's Julie, ready to answer Kirsty's question. So Kirsty has asked, what do you pack in a doula bag and what do women generally find useful? I have a TENS machine, will we use it? And what about rebozos? So I thought I'll do a quick video and then I'll upload that as an answer. And this should be fun. And I hope everybody else gets inspired to ask me lots of questions each week, each day, whatever you want. So not just for Kirsty, but for everybody. But I'm delighted, Kirsty, that you got the ball rolling. In your Birth Doula book on page 106, you'll find a list. You know that I'm a list person, don't you, when you've read my book? Julie's list of what to pack for labour or to have some basics assembled for a home birth. So there's a lot there and it's all focused on the mum. But the other thing that I want you to fill in the earlier on in the Birth Doula workbook is other things that you want to pack in your doula bag. And I'm thinking of you. I'm thinking, what are your needs going to be? So you're going to need some food. You'll need a toiletries bag. You will probably need things like tampons, any medication that you normally take. Pack as if you're going away for 24 hours, maybe 48 hours. You'll need a toiletries bag to brush your teeth, all sorts of things like that. Anything that you'd normally need on any day or two and overnight as well. So think about things that you would need to freshen yourself up if you're starting to feel a bit stale. I think I took along some, what did I take? Some chewing gum at the last birth I was at. I couldn't get anything to eat. There wasn't time to eat anything, so I thought, well, I'll just stop my stomach from growling by having some chewing gum, and it worked. And you know what I did wrong at the last birth I was at? I didn't actually drink any water. I forgot to bring a water bottle. Something as basic as that. I didn't have time to get outside and get anything to drink out of. I did consider using my hand and cupping my hand and having some water. And in fact, I did a little bit just to wet the inside of my mouth. I became really dehydrated. I came home from the birth thinking, I think I've got a bladder infection, a urinary tract infection, and I took an antibiotic. And then I went to sleep. I just absolutely crashed out for 3 hours and woke up, and then I took another antibiotic and I had a shower, and then I broke out in a rash head to toe. I had an allergic reaction to the antibiotics, puffed right up big time. And I thought, oh God, I need to go to hospital. And I thought, I'm too tired. So I thought this will either kill me or I'll recover just by sleeping. So I laid down, and 3 hours later I woke up and I was perfectly fine. So not recommended to go to a birth without your water bottle. You'd think I'd know, wouldn't you, after all these years? But we still make mistakes. Never mind. I survived. That's all that matters. So TENS machine, listen, I'm going to come clean with you. I'm not into TENS machines. I know that a lot of people cling to them with the idea of, oh, maybe it'll work, maybe it'll help. But the truth is, nobody knows exactly how they work. And I used to work in a hospital, and the head of physiotherapy said to me that she wouldn't use one. It is good, don't get me wrong. TENS machines are good for rehab, injury recovery, stimulating oxygen to tissue after things like a car crash or an operation and things like that. So they've definitely got their place. But if you put a TENS machine application on a woman's back, the idea is as she's getting her cervix is thinning out and opening up during her labour, she's getting a message of pain from her cervix up through the spinal cord, the pain gateway up to the brain, which is good. That's what we want. We want a lot of message going to the brain saying, ouch, we've got some contractions, therefore we're feeling some stimulation, some period-like sensation, and also some lower back and deep pelvic pressure, right? So the normal feelings of a contraction. Now, what happens is that message goes to the brain, and then the brain says, oh, you've got a lot of muscle function happening there, haven't you? So I'm going to release endorphins. And after every single contraction, another massive release of endorphins. Finally, by the time the woman is fully dilated, pushing, baby comes out, she is mega loaded with endorphins. She's on an incredible high, and therefore she's going to be absolutely ecstatic when she receives her baby in her arms. So what we do if we put on a TENS machine is we scramble the message of pain going up to the brain, and the brain's like, not really sure what's happening there. Therefore, we're either not going to release endorphins or not many endorphins because it's all getting scrambled. The brain's a bit confused, not sure what's going on. And the woman will often, not always, but very often, if you read a lot of birth stories where the TENS machine is involved, the woman's birthed, she'll say, I got to about 4 centimetres. I was sick of the TENS machine. It wasn't working for me anymore. I ditched it in favour of an epidural. So if we're relying on something external, like a TENS machine, to get us through, we're going to get to a certain point and then look for something else external to get us through. That's the epidural. So the other thing with a TENS machine that any midwife will tell you is, and any doula will tell you, you can't get in the shower. It's an electrical device. We can't use the bath. It's an electrical device. So you can't mix water and electricity, right? So there you have it. Now, rebozos, I've purchased a few over the years, from overseas, and if you have a feel of the fabric, sometimes they're quite rough. So I've purchased them from South America. Anyway, I wouldn't want it against my skin. So if you can get a really soft one, that would be great. But otherwise, pretty good size, decent cloth, a big sarong that's really silky, or better still, something that's a little bit stretchy, like t-shirt fabric, cotton with a little bit of poly in it. Maybe 1 metre or 2 by maybe 1 metre, so pretty good size. You wrap it underneath a woman's belly. It depends on what position she's in, doesn't it? So maybe get the woman into the hands, knees position, thread it through under her belly, softly cradle her belly and help her to rock backwards and forwards. So that seems to be the favourite way to use the rebozo, but there is actually a lot of different ways you can use it. No, haven't built it into the course. If I built everything into the course, the book would probably be about 3,000 pages. So it's the sort of thing to look online and experiment. So hopefully I've helped you there today, and I look forward to helping you guys a lot more. Let me know what you think of the video.